Hi, my name is Kate McBride. I'm the coordinator of the Sexual Health Rehab Service at Vancouver Coastal Health, Vancouver, British Columbia. And I'm here today to talk to you about sexuality and spinal cord injury. We're very fortunate to be doing this video today with the help of the Canadian Paraplegic Association of Alberta. In this video, you will hear some of my colleagues speaking about their clinic experience working with people with spinal cord injury. You will also see some people, a man and a woman, who have spinal cord injury and who have lived with spinal cord injury and adjusted to the sexual part of their life.
My name's Terry. I am currently starting my own fashion design business, and it's called Normal Fashions. I'm married. I've been married for almost 4 years now. I have a 19-month-old son, and so I consider myself a stay-at-home mom and self-employed. I had a car accident 15 years ago, which left me a C6-7 complete quad. So when I got injured, I actually was a fashion model, a dancer. I worked for a software company. I'm 5'11", I'm a pretty tall person, and so image was really important to me. I felt like that was all gone after I got injured. I never thought that I would meet someone or start dating or even have a sex life. Actually, when I first got hurt, it was the last thing that I thought about. I was in a relationship before I got injured, and he decided that it wasn't something that he could handle, so we did split up. And after I got injured, I found that it was really difficult to trust someone, open myself up, and even feel good about myself sexually and as a woman. I sort of felt like I was now this individual in a chair and not a woman anymore. I would say it probably took me about 5 years before I finally met the right person that I decided to have a sexual relationship with. I think it took me a while to find the right person. I was really afraid of having sex. I was afraid because, of bodily functions. I was afraid of, just having the other person think that I was just lying there and not participating. I was afraid that I wasn't attractive anymore, and I didn't feel like I was attractive. I felt like people looked at me like I was a person in a chair and not as a woman, not as a sexual being. So I met my husband a number of years later, and we actually met on the internet, and it was great. I mean, he was great. He didn't even think about the chair. Like, that was one thing that he always said, was that it was just, he saw me as a person and not me as a person in a chair. And that, of course, was really important to me. He probably has to do a lot more than the average man with an able-bodied woman, but he doesn't even think about it. It's just part of our life together. My husband and I, when we got married, we thought about having kids. We actually debated it for quite a while, and then finally came to the decision that it was something that we wanted to do, but it was a difficult decision to make. One of our biggest concerns was dysreflexia. So as most quads probably know, it's a symptomatic response when your body goes into pain, and you can actually get a stroke. So that was one of our biggest concerns of me being pregnant, was having dysreflexia and not getting to the hospital in time in order to deliver the baby. So when I was pregnant, I actually had a really good pregnancy. I didn't have any complications at all, and I was able to go into the hospital and have a vaginal delivery. I didn't labor on my own, but I was induced because I was 41 weeks. I was able to push the baby out for the most part, and then need a little help with forceps at the very end. But all in all, it was a very straightforward, very exciting, probably the best moment of my life. Delivery, pregnancy, and everything. And now I have an absolutely beautiful, healthy, big baby boy. I think I would probably give someone who's just newly injured, a woman who's experiencing sort of self-image issues and wondering if you're ever going to get back into dating and having a sexual relationship, is, take your time and be comfortable with yourself, and, be confident that you will meet the right person, because You know, there are so many great people out there who won't even see that part of you, and eventually it's just like another appendage that you manage to work around. And all of those things that you worry about, you know, your bodily functions, your, you know, feelings about how you're going to be in bed, really it all goes away. And as long as you're with the right person, they will make you feel great.
Hey, my name is Brad. I broke my neck in May 1994 when I was 24 years old, diving into a glacier river. I was with a bunch of friends. We were all 24, active, healthy, young guys. The moment I dove into that river, my whole world changed. And sexuality was going to be one of them. You know, I don't know if you really think about the whole walking and all of that. At first, you're just in shock of what's going on. And when I was getting carried up to the ambulance from the river, I had my friends beside me, and you know, one of the things I thought about first was am I going to be able to have sex again? I had a beautiful girlfriend waiting for me at home, and all of a sudden I felt this feeling in my shorts, and you know, I started to get an erection. I said that to Cam, the guy who pulled me out of the river, and he looked at me with such happiness and glowing in his eyes, and he said, "Everything's going to be all right, man." So I know a lot of guys that have had spinal cord injuries, and I talked to them quite early on in their recovery, and sex seems to be one of those unspoken topics, and a lot of it has to do with your pride and your ego, and a lot of it has to do with fear too, because you don't understand what's going on. And you got maybe a wife at home or a girlfriend, or maybe you're a single guy and you're wondering how you're going to be able to get, you know, back together with someone and have that sex life that you had before. And that sex life doesn't look the same. You know, your physicality has changed, your sensation has changed, your bodily functions have changed, and all of these you're trying to grasp, especially early on. You know, how's this all going to work? And for me, that took time, but it also took taking some risks. And I would say that's one of the biggest things you need to do is you need to, you know, get outside of your comfort zones and get outside of those fears and try some things. As important as physiotherapy, occupational therapy, and rehab therapy is sexual health. And your sexual health department in your rehab center is a place you need to get to. There you're going to find information, you're going to find resources, and you're going to be able to talk to somebody who understands what's going on. And you can't hide from these people. You can't hide from it forever, so you might as well get it over with. And the sooner you do, the better your sex life is going to be. And probably the most important thing is that we're having fun, and we laugh a lot, and we're always trying to change it up. You can't just stay doing the same stuff. You got to get out of your comfort zones. You got to go into different places, and you got to create new scenarios. Okay, one of the most important things that a person can do for themselves after having a spinal cord injury is educating yourself. Educating yourself about your injury, about your level of injury, and about your bowel and bladder routines and all of these things, because with that is going to come confidence. And there is nothing more attractive to the opposite sex or to the person that you're interested in than confidence. And if you can meet somebody and display that and, you know, show that you're, you know, you can take the lead, you can be the person that sets up new and interesting kind of rendezvous, that's the kind of thing that's going to keep your relationship or keep people interested in you. So work on that.